Walking pneumonia. It sounds almost harmless, doesn't it? After all, if you can walk, how sick can you be? This misconception is precisely why this infectious respiratory illness is a growing concern, particularly as we witness a recent surge in cases. Caused by the bacterium Mycoplasma pneumonia, walking pneumonia often presents with milder symptoms than typical pneumonia, often leading to delayed diagnosis and treatment. Unlike its more severe counterpart, which can confine individuals to bed with high fever and difficulty breathing, walking pneumonia often begins subtly. Patients may experience fatigue, a persistent cough, and low-grade fever, easily dismissing these symptoms as a common cold or allergies. However, this seemingly innocuous illness can linger for weeks or even months, impacting daily life and potentially leading to complications if left unaddressed. The recent uptick in walking pneumonia cases has raised alarm bells within the medical community. Together, these epidemiological, microbiological, and medical factors contribute to the increased cases of walking pneumonia. Addressing these issues through timely diagnosis, awareness in high-risk settings, and appropriate antibiotic stewardship can help control the spread. Please, subscribe now to join our community. Give a thumb to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, Medicine Health 360, has many more videos to bring the crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We value your feedback, so share your thoughts and let us know what you think. As temperatures drop and leaves begin to turn, we find ourselves transitioning indoors, seeking warmth and comfort amidst the changing seasons. However, this shift in our behavior coincides with an increased risk of respiratory infections, including walking pneumonia. Why is this the case? The answer lies in the close proximity and increased person-to-person contact that occurs within enclosed spaces during colder months. Mycoplasma pneumoniae spreads through respiratory droplets released when an infected person coughs or sneezes. These microscopic droplets can linger in the air, particularly in poorly ventilated environments, increasing the likelihood of transmission. Schools and workplaces become breeding grounds for such infections, as individuals congregate in close quarters, sharing air and surfaces. Furthermore, the resumption of social gatherings following a period of pandemic-related restrictions has also contributed to the recent surge. Concerts, sporting events, and holiday parties, while joyous occasions, create opportunities for widespread transmission as individuals from diverse backgrounds converge and interact in close proximity. Adding to this complex interplay of factors is the cyclic nature of Mycoplasma pneumonia epidemics. Outbreaks tend to occur every 4 to 7 years, often coinciding with environmental factors such as temperature and humidity changes. This cyclical pattern, combined with increased social interaction and seasonal changes, creates a perfect storm for the spread of walking pneumonia. To effectively combat walking pneumonia, we must first understand the nature of our adversary, Mycoplasma pneumonia. This tiny bacterium, among the smallest known to cause human disease, possesses unique characteristics that enable it to thrive and spread stealthily among us. Unlike most bacteria, Mycoplasma pneumonia lacks a rigid cell wall. This structural difference has significant implications for both its survival and its response to treatment. The absence of a cell wall renders this bacterium naturally resistant to certain antibiotics, such as penicillin and its derivatives, which target cell wall synthesis. This inherent resistance poses a challenge for healthcare providers, who must carefully select appropriate antibiotics to effectively target the infection. Further complicating matters is the bacterium's ability to alter its surface proteins, a phenomenon known as antigenic variation. This constantly shifting camouflage allows Mycoplasma pneumonia to evade our immune system's memory, making it challenging for our bodies to mount a swift and effective defense, even if we've encountered the bacterium before. Adding another layer of concern is the emergence of resistance to macrolides, a class of antibiotics commonly used to treat walking pneumonia. Overuse and inappropriate use of these antibiotics have exerted selective pressure on Mycoplasma pneumoniae, favoring the survival of resistant strains. This trend towards increasing antibiotic resistance underscores the importance of judicious antibiotic use and the need for novel therapeutic strategies to combat this evolving threat. Mycoplasma pneumoniae is a cunning adversary, outsmarting our defenses and treatments. It develops resistance to antibiotics, especially macrolides, through genetic mutations. Overuse of antibiotics accelerates the spread of resistant strains. It can persist in the respiratory tract, leading to prolonged transmission. The bacterium evades our immune system, increasing reinfection likelihood. Post-COVID-19 immune vulnerability necessitates proactive measures against walking pneumonia.